Hi everyone, we're going to get started talking about photoaging. Okay, so photoaging is something that each and every one of us treats on a daily basis. We are constantly trying to beat it. You can see this image of the infamous truck driver who was published in the New England Journal, really beautifully highlighting the effects of ultraviolet light on the skin. Now, fortunately, thanks to the advent of fractional photothermolysis by Drs. Rox Anderson and Dieter Manstein 20 years ago, non-ablative resurfacing has really emerged as the preferred treatment modality for photoaging, given the preferential side effect profile, reduced downtime. Now, the low-powered 1440-1927 diode system has been shown to safely and effectively reduce photo damage on the face. Now, other non-ablative resurfacing systems have shown efficacy off-face on the neck and chest. However, the 1440-1927 diode system specifically has not yet been formally studied off-face on the neck and chest. So our study objective was to prospectively investigate the safety and efficacy of this non-ablative laser system in addressing photoaging symptoms, specifically pertaining to rhytids, skin roughness, dyschromia of the neck and chest. So our subjects underwent 4 treatment sessions in total. They had 4 passes of 1440 at the highest setting, followed by 4 passes of the 1927, also on the highest setting. These treatments were done 4 to 6 weeks apart. They then came in 3 months after their last treatment for our follow-up interval, at which time both treating and blinded physicians evaluated them for wrinkle severity, texture, pigmentation, as well as global aesthetic improvement scores. In total, 20 of our subjects completed the study, corresponding to Fitzpatrick skin types 2 and 3. This included only Caucasian patients. And overall, every photoaging metric that was evaluated in the study showed significant improvement at our follow-up visit. Specifically, skin texture on the neck and chest improved the greatest by 41% and 38% respectively. Here are some clinical images from our study subjects. In patient 1, you can see kind of a milder result. There's a subtle improvement of the pigmentation at the follow-up photo, as opposed to subject 2, who had a more moderate improvement with nice improvement of the background dyschromia in the follow-up. Our blinded physicians also evaluated our patients based on their baseline and follow-up photos, specifically for rhytids and pigmentation only, because it was just tougher to discern texture on a photo, and their scores trended towards mild improvement. Post-treatment side effects were really consistent with what we know on the face. All of our subjects, or the majority of them, experienced mild to moderate edema and erythema. There were no instances of crusting or erosion. And our subjects really noted considerable improvement overall for their neck and chest, with scores corresponding to upwards of 25 to 49%. So in conclusion, treatment with the low-powered, non-ablative, fractionated 1440-1927 diode system is safe, results in mild improvement in wrinkles, skin texture, and hyperpigmentation. I would say our results are milder compared to the higher-powered 1550 erbium and 1927 thulium systems, but also balanced by the fact that the downtime was much less. We practice in New York, and as you all know, New Yorkers are really not tolerant for downtime at all. They want to get in, get out, and then go back to work. So I do think this is a nice option for patients who are really not downtime tolerant. Our study was limited by a small sample size, and also, most importantly, the limited Fitzpatrick skin type range. So future studies are important with a broader Fitzpatrick skin type included. But I would say that we use this system very often on skin of color and are very comfortable and really don't have any problems with it. Thank you.